We're live here at HCIC in Austin, Texas.
Podcasters are today's influencers, so you included.
I'm no influencer. Being a little bit modest. He's modest, guys. You're not deliberately being a competitor. You're just better at it. We're here live at HCIC in beautiful Austin, Texas, with the incomparable and wonderful Laura Lee Jones. Welcome to the podcast.
Thank you, Chris.
I'm excited to talk to you today.
I know we planned this a few times and we've never made it work.
And now we're making it work,
Yep.
and it's even more special because just this week you've been awarded the Lifetime Achievement of the John Udy's Award, which is pretty significant, pretty powerful. I mean, that's an award that recognizes individuals in this space that have been doing things that have shifted and changed our industry. That I'm not surprised knowing you that you got that award. So congratulations.
Thank you.
Do you
Means a lot.
Do you want to share, though, a little bit more about what you do and
Sure.
the great company you run?
Sure. I am Laura Lee Jones, CEO and founder of LionShare. We are headquartered in Kansas City. And for more than 30 years, we've been putting together healthcare databases, marketing automation, great marketing campaigns, and measuring ROI.
More than 30 years.
More than 30 years.
I mean, that was before there was an internet.
We were probably only the second company to bring CRM to the healthcare space.
Wow.
Yeah.
Wow. I mean, if you look back at that, and I know you've been thinking a lot and looking back at
Yes.
you've seen a lot of change happen in this
Yes.
space, right?
Yes.
So let's talk a little bit about you seeing that, because we are, after all, here at the HCIC, where, it's a cutting edge of technology.
Yes, this great conference.
Yeah, right?
Thank
We're
you,
learning-
Kathy Divis.
Yeah, I know. And we're really we're hearing about all the new tools and technologies, AI, et cetera. But I'd love for maybe get your perspective on the last 30 years. How have you seen things shift and change?
Yeah. Well, the technology, certainly, there's a lot of new technology, which is really important. One thing that I have not seen change is the need for great service. So with the new technology comes a lot of dollars and a lot of investments, but it's not also always coupled with a great service team. So great service still matters.
But we've heard a lot of people talk about consumer and consumerism and what they need and all of these things. And honestly, the more we can address what that consumer need is, the better off we're going to be from a volume perspective.
Agreed.
At least that's what I've always
And I
felt.
really do like that finally healthcare has identified that the consumer is first.
Mm-hmm.
And I love physicians, but it's not about what the doctor wants. It's about what do our patients need and what does our community need.
And who is our real customer?
Yes,
Right?
yes.
And I think that's something that when we sit in the marketing and digital marketing
Yes.
suites, we sometimes forget that, because we hear knocking on the door or, in the meetings, that clamor from the inside of we need to do this, we need to accomplish this. But honestly, if we can respond back in a strong way to say, we're actually serving our customers, and our customers are our patients and potential patients.
Yep.
That's the right thing to do.
Yep, I agree.
And I think that's what's great about what you do as a CRM company is you really intersect your technology and the analysis and the data you have to allow organizations to see that. And fundamentally, have you seen a lot of shifts in the application of the CRM? It's not really a technology; it's really a strategy, right? In CRM,
I agree.
strategies?
And as we've been doing it a long time, and it's still fascinating to me that the C-suite does not often recognize the value of it and the need for some of the most basic things, like let's talk to our lapsed patients. Just super simple, low-hanging fruit. And instead of going outside for acquisition, focusing on retention and acquisition within their patient database.
Mm-hmm. Yeah, I know. It's funny. There was 5 years ago even, I was talking to CMOs, and they're saying, look, once we only care about the prospect
Yes.
in our marketplace. Once they become patients, they're not ours.
Yes.
I think that's
That's the biggest problem inside is the chief marketing officers are now finally being valued at the table. Mm-hmm. They need to be part of that and not siloed, and also not told, here's what we're going after, but why are we going after them and what is our goal? And we like to ask our clients, so you want to drive cardio. Are your clinics available? Can you make an appointment? Oh, it's 16 months to get an appointment with a cardiac doctor. That's a problem. Operationally, marketing has to be aware of that at all times before doing a campaign.
16 months to see a
Yes.
cardio patient.
Yeah.
I think, and that's just for those of you that are not in the industry, I'm telling you, that's sometimes what the reality is.
It's normal.
And we as marketers now, we're being asked to be the voice of the customer.
Yes.
We're being asked to champion that customer's
Yes.
voice. And I just wonder from your perspective, do you think we have the strength, the wherewithal to have that responsibility to
question.
drive internal change?
Yes, we do.
Okay.
I think we do. And I do think some systems are bringing leaders from outside of the industry because they see healthcare as a great place to be profitable. But we need to teach them the difference between business. We're not selling TVs. No one wants healthcare. I don't want to know about cancer care and Parkinson's and any of these other ailments. You don't shop for it until you need it.
Yeah. We don't want to know unless we really want to know.
Right.
And
right.
that's an interesting perspective.
That's what we need our leaders to understand that.
Well, so getting back to, and you mentioned leaders, right?
Yes.
I think the leadership of us, not only inside health systems, but also outside,
Yes.
is critical to kind of
Agreed.
advance this. And changes are going to occur, right?
They
5
do.
years from now,
Yes.
it might not be AI, because AI will be embedded in everything, and maybe it's virtual reality, or maybe it's who knows what. But there's some core principles that never change, right?
I agree.
And that core, so what are they?
For me,
Yeah.
being authentic, direct and honest communication, no matter what group you're talking to, and getting really comfortable with change. And it's not easy. I mean, my company's made it in this industry, and it has not been easy all the time. But I think one of the reasons that has happened is I've been very straight up talking. So being comfortable going into a C-suite and even with clients and speaking to a CEO directly. Like, this is going to be uncomfortable, but I'm going to speak truth to you.
And that honesty, that integrity, really,
I agree.
is what carries us through. And I think that's what has made you so successful over all of
And
these.
don't sell something you can't produce.
Oh my gosh. Thank you
Yes.
so much for saying that. I think that's so important.
Yep. Me too.
Laura Lee, I mean, you've been recognized by the industry as being, inspiration, a thought leader, and you mentor a lot of people
I
in this
do.
space.
I like to.
And I think that that's one thing that's really a testament to your honesty and your integrity. And I'm really grateful for you spending a few minutes here and sharing your insights.
I'm happy to be here, Chris. Thank you.
Thank you.